My name is Scott, and today I'm going to be talking about non-invasive ventilation, and that's going to be with the BiPAP today. I want to go over the indications for it. It would be basically patients with CHF, acute or chronic respiratory failure, and patients with neuromuscular system disorder, and basically like obstructive sleep apnea patients. The contraindications for this would be basically barotrauma, because it can cause that. Aspiration is at risk, and also it can cause patients to choke. The complications for it will basically be tissue necrosis. So tissue necrosis and also barotrauma, and basically a patient with high aspiration risk. Now, before I go in, you want to review the patient's chart and the physician's order. The physician might have like something about settings, but since I'm doing this right now, there are not going to be any settings, so I'm just going to do with the standard settings. And then you're going to look if the patient has been on a BiPAP before, or if they have a mask already, and basically you got to size the mask. So you're going to look for that, and then you're going to gather your necessary equipments. So today, I have stethoscopes. I'm going to assess the patient first, and then before and after. I'm going to have the vent, my cochlear tubing. You're going to want the filter with the expiration port, and then you have the pressure line. And then oxygen. You're going to connect to the wall if they were on oxygen, and then the plug, which you're going to plug into you're going to plug it into a red outlet because it has a backup generator in case if anything happens, the vent will still be working. You're going to get mask, small, medium, and large. Just bring it in. That way you don't have to run back and forth in case it doesn't fit. And your template. So advantages for using a BiPAP would be it's non-invasive, so that's good. A patient doesn't have to be sedated, and it's going to take out the risk of infection, like pneumonia or anything like that. Let's talk about trigger and cycle. So trigger is basically the patient like spontaneous breathing. The patient will be able to take a breath. You can trigger it. Cycle will be like if the patient isn't taking a breath, the machine will cycle and take a breath for him. It'll initiate it. Yeah. Okay, so at this moment, I've got my stuff. I'm gonna wash my hands, and I'm gonna wash my hands, put some gloves on. And then don't forget to check the patient's charts and orders. Yeah. Okay, so knock, and we're gonna go in. Hello, my name is Scott, and I'm a respiratory therapist. Today, I'm gonna be putting on a BiPAP machine, which is gonna be helping you, helping open up your lungs, help you with your work of breathing. It's gonna kind of help you breathe a little easier, okay? Explain to your patient, and then ask him for their first name, date of birth, and medical record number. Ask him, look for it. Okay, Mr. Parker's right here. Okay, him and the family understand what's gonna happen. So, put on some gloves. First thing I'm gonna do is I'm gonna assess the patient. Okay, so I'm just gonna take a listen to your lung sounds. And we're going to put a pulse ox on the patient too. Okay. All right. Take a deep breath in. Okay. So assess the patient. He knows what you're going to do. Now, we're going to connect the oxygen to the oxygen port. Connect the plug into the red plug. Filter here. Make sure you get your go in here. Okay. Closer. Alright, so now that it's on, silence. Okay. Go to menu. You're gonna check the mask in the port with that setting. And then you're gonna basically, on the Respironics mask, it's gonna have a number on it, which is the 1. That's what you're gonna pick. So 1's right there. Click accept. And it's asking for your port, which is gonna be this one right here. If you have a different one on, just push other. After that, it's gonna ask for a load test. It's gonna check for leaks. So I'll close your hole and start test. Okay, test is done. It says it's passed. So now we can go to resolution. Let's go to modes. Click batch ST. Now you're gonna set it up. So I want to set up a standard first. You're gonna monitor the patient and just fix it to however you think that the settings they need. But we're gonna start with 10 for the IPAP. And for the EPAP, you're gonna do 5. For the rate, you can actually keep it at 12. Oxygen, put it at whatever they're at, or just 21% as of right now. That's what I'm gonna stay at. Odd time at 1 is good. The rise time is at 3. You're gonna activate. Okay. After it's activated, let's start with, my bad, finding out what size he is. Okay, so usually small works, but you always want to check. When you measure, you want to measure the bridge of the nose to the bottom lip. So you're going to want to check all of them to see if it works or not. Apparently medium doesn't work, so go to small, alright? And you want to find the mask that is the smallest that can fit comfortably for the patient, because you don't want any leaks, and you also don't want it to be too tight. When you do put the mask on, you don't want to over tighten it, and the mask doesn't want to be too tight on the patient's face, because it can cause tissue necrosis, which is like bleeding, bruises. It can like just rip apart. It's not good. Okay, so now that he's sized, what I want to do, I'm going to work on the alarms after I fix the mask on for him. So for patient comfort, you want to kind of take the mask, connect it first. There we go. I'm going to talk to the patient and be like, I'm going to put this over you, and we're just going to try to get you comfortable with it, okay? See how it feels. Okay? So you hold it there. Let him kind of breathe, inhale and exhale. And kind of get used to it. And then now, when the patient is, okay, I'm going to strap this on now, okay? Go. So it's still pretty loose. What you want to do is put it on his face, right? Put the tube part, and when you fix it, you want to kind of tighten it just enough, with both at the same time. And you want to check for space. You want to just make sure it's a little tight enough, but not too tight. Let's go a little more. Okay? Alright. And at this point, you want to also let the patient know that if they feel like throwing up or they feel uncomfortable, something is wrong, they can always take it off by unclipping the hinge. You can click one, move it up a little bit, or you can just click both if you need to throw up, and just lift up. Alright, so there we go. Now let's work on the patient alarm. We're gonna have to work on the alarm settings. So at the high rate, my rate's at 14. I usually want to go like 10 higher. So I want to basically go like 25. And for the low rate, I think 12 is good. I mean, the regular respiratory rate is 12 and 20, so you kind of want to go in between those so it can alarm correctly. We're gonna follow total volume. I know this says 200, so that's not really right. But we're gonna let's start with let's say that the total volume is actually 600. I'm gonna go 300 above and 300 below for the alarm. So if it's 600, this is gonna be what? 900, and this will be 300. Okay, and then your hip and your lip. Hip is high inspiratory pressure and lip is low inspiratory pressure. You want to correlate these. Almost going to be the same as your rate, but you're going to look at your PIP. And if this is at 6, then you want to go about 5. Yeah, around there. So 10 would be cool, or yeah, and so now it's 9, you know, so I guess just staying at 15 is okay. And then the lip should be around like, let's just say 5. It was at 4. Yeah. Okay. So if you're with the patient and they look like they're doing okay, you just want to monitor them, see that everything is going all right. If you need to take an ABG from the patient, make sure you do it 30 minutes after they've been vented, or after they've been, after you put them on the machine. And the reason for that is because you want to check their pH levels, their oxygen, and their carbon dioxide. So if the patient was having a carbon dioxide problem, CO2, then you'd want to increase the IPAP, and it's going to help with their CO2 levels. But if they need oxygen, then you're going to increase your EPAP. So say if they need oxygen, you're going to increase the EPAP to 3, but their CO2 is okay, so you're going to increase the IPAP as well to 3. That will keep delta P the same. You're going to have a good, it's going to be a good tidal volume, and they only needed oxygen, so that's what that's going to do. Okay, so I already talked about spontaneous trigger and cycle, and yeah, so yeah, after you do that, remember to chart, but you need to also reassess the patient. So go back and take a listen. You should be hearing like air, so that's how you know it's working and it's helping. So let's take another listen to Mr. Parker over here. And then don't forget to chart. You can have your flow sheet, and you want to chart your whatever settings that you put on there, your settings and your alarms. Okay. Check their saturation levels. Make sure the patient is feeling comfy. And then let him know that if there's anything that he does need, then he can call for the nurse, and they can come. Now that it is set up, you want to just double check, make sure everything's okay. And yeah, just take out your gloves. Already reassessed. If you do need to change any settings, make sure to change it. But then you also need to let the physician know that you've made some changes. Always talk to them. And yeah. Okay, take all your necessary equipment out, wash your hands again, and then remember to chart.